It's a real cause for concern. The information is coming in so quickly. The science is moving quickly over the course of the weekend, but we have a much higher degree of confidence now that there does appear to be an increased risk of transmission with this new strain. We've heard quoted that number 70%. What's really important to note here, a lot of this is done by modeling, that we're seeing rates of the new strain become more and more prevalent in certain parts of the country, and that actually this new variant was spreading exponentially during the UK's lockdown that happened in November and early December. So despite all of those restrictions at that time, that wasn't enough to contain this new variant of the virus. And for me, that's a real cause for concern.
Right. You know, it's interesting you say that, because I was going to ask you if the main takeaway, the lesson that we've learned from this year is that the only way we can get a good control of the virus transmission is by going for harder lockdowns. And yet, we had another lockdown in November, and cases were on the rise again because of this new mutant strain that has come up that is clearly a lot more infectious. So what is the way out of this, Peter?
Yeah, I think you're partially right. The answer is not necessarily harder lockdowns, but the answer is a more aggressive strategy, what we call the zero COVID strategy. The idea that no amount of the transmission of this virus is acceptable. And that does mean strict, though hopefully smart measures to control the spread. But it also means investing a lot more in building systems for testing, contact tracing, isolating, and supporting the ways that Singapore and South Korea and Taiwan and China have been able to do, and then finally smart border closures. We really need to crush transmission of the virus and get it down to minuscule levels. It's been done now in Australia and elsewhere. That's the only way forward, and is the only way to give some predictability that's going to keep the economy going as well. It is possible. We've never adopted that strategy. This tier system hasn't worked, and I don't think it's going to work, and I think we need to change our strategy.
You talk about border closures. What is your reaction to 40 countries in the world banning travel out of the UK into their countries? Is that going to work for them? And already there are signs that the virus is already on the continent. So in many respects, people are saying, well, look, it's too late for them to close borders now.
You know, I think it's a reasonable precautionary measure given the potential significance of this new variant if it does spread as quickly as we indeed think. And you know, we don't yet know. One thing is that the UK has a phenomenal surveillance program, and so it may have been the first place to pick this up. But if there are a few cases of the new variant in other countries, you know, it's still worth trying to prevent a further influx of new infections, right? Think about what happened to us back in March when, you know, sometimes there were some bans from travel to China, but not to Europe. And so people went and holidayed in Italy and elsewhere. And then we had thousands of introductions of the virus all at one time. And then we saw a tidal wave of infections in the spring. That's the kind of thing that we want to prevent. What's important, though, is that border controls are one part. We need to prevent transmission across borders. We also need to do more to prevent transmission within borders to prevent this getting out of control.
Well, one positive note that came out of the press conference yesterday, the Prime Minister said that about 500,000 people in the UK have already been inoculated with the first dose of the Pfizer-BioNTech vaccine. So, you know, at least it's getting off to a good start. Is the hope here that we can inoculate people fast enough to stop the very fast spread of this new strain of the virus? Is there any hope that can be achieved?
That's absolutely key, and if anything, we should be trying to accelerate our efforts to get the vaccine out and into people as quickly as possible. So far, there's no evidence to suggest that this new variant would be impervious to the vaccine. The vaccine should work, according to all the vaccinologists and virologists that I've talked to. And so it's very important that we try to get this out as quickly as possible. The reality is, though, if anything, a more transmissible virus means that we would need to reach a higher percentage of the population with vaccination to give that herd immunity protective benefit. And so we do need to accelerate vaccination, but we also need to be smart about all the other kinds of measures we need to take to slow the spread, because it's still going to be months before we reach those targets.